Today we'll look at a very common and frightening situation. Your heart suddenly starts pounding while you're at home. What to do in the first minutes, which techniques genuinely help and which are dangerous, and most importantly, when it's time to call an ambulance. Step by step, and calmly. An arrhythmia attack at home, the step-by-step plan. Picture this: you're sitting quietly, and suddenly your heart starts pounding as if it wants to leap out. Your first thought is that something's terribly wrong. Let me show you a clear plan for what to do in these minutes and what you definitely mustn't do. Palpitations are the sensation that your heart is pounding, fluttering, or skipping beats. Most often they're completely harmless and linked to stress, coffee, or lack of sleep. Short episodes are usually not dangerous, and it's important to grasp that straight away. When people say tachycardia, they mean the pulse is above 100 beats per minute. A faster rate on its own isn't a diagnosis. What matters is how long it lasts, how well you tolerate it, and what symptoms come with it. Attacks come in different forms. Supraventricular tachycardia is a sudden, very fast rhythm. Atrial fibrillation is the most common sustained arrhythmia, where the rhythm becomes irregular. And sometimes the heart pounds even with a normal rhythm, simply from anxiety. How do you tell whether it's dangerous? Go by how you feel, not just your pulse. If the attack is short and you feel fine, it's usually nothing to worry about. If it's long and comes with severe symptoms, that's a reason to act. The first step is always the same: sit down, breathe out, and don't panic. Panic itself speeds the heart up. Slow, steady breathing, and no coffee or cigarettes at this moment. Often that alone is enough to settle the rhythm. There are safe home techniques that slow down a too fast rhythm. They're called vagal manoeuvres. They're the first line of help for supraventricular tachycardia. But before using them yourself, do check with your doctor that they're right for you. How effective is it? Classic maneuvers restore a normal rhythm in roughly 5 to 20% of cases. The modified Valsalva maneuver, in one study, worked in 43% versus 17% for the standard one. That's a huge difference. The modified maneuver goes like this: half sitting for about 15 seconds, you blow out forcefully, as if blowing into a syringe. Then you lie flat on your back straight away, and someone raises your legs for 15 seconds. It's this combination that works best. Another safe option is cold on the face. Splash your face with cold water or hold an ice pack to your face for about 10 seconds. This also helps slow the rhythm. But do it in moderation and carefully. Now, what you absolutely must not do. Don't massage your neck over the carotid artery. Only a doctor does that, and not for everyone. And don't plunge your whole face and head into icy water. There's a real risk of breathing in water. Caution matters more. There are symptoms where you don't try the maneuvers at all, but call an ambulance straight away. These are pain or pressure in the chest, fainting or severe dizziness, and shortness of breath. Also, if the palpitations don't stop on their own and only get worse. A simple rule: sustained palpitations plus chest pain, difficulty breathing, dizziness, or confusion means calling an ambulance immediately. In that situation, don't wait and don't experiment with maneuvers. Better safe than sorry. Once the attack has passed, it's important to get to the cause. Your doctor will order an electrocardiogram, if needed a 24-hour monitor to catch the rhythm, and an ultrasound scan of the heart. This helps work out exactly what's going on and how to treat it. It's worth knowing the numbers on atrial fibrillation. According to Danish data, the lifetime risk has risen from 24% to 31%. It used to be about 1 person in 4, now it's 1 in 3. The arrhythmia is becoming ever more common. Many people think fibrillation is only dangerous because of stroke. But the same data show the most common complication is heart failure, with a lifetime risk of 41%. Stroke is 21%, heart attack 12%. So arrhythmia mustn't be ignored. The good news, you can influence arrhythmia. The modern approach puts controlling risk factors first: blood pressure, weight, blood sugar, sleep apnea, and alcohol. And in suitable patients, the rhythm is restored with an ablation procedure. All of this is decided together with your doctor. So the plan is simple: sit down, calm yourself, use a safe maneuver if needed, and watch for the red flags. Most attacks aren't dangerous, but everyone should know how to act. If this was helpful, do subscribe and look after your heart. Remember the key point: in most cases, a bout of palpitations isn't dangerous, but everyone should know the plan and the red flags. Look after your heart, and if this was helpful, do subscribe. There's plenty more important content on rhythm to come.